You will also receive a link to an evaluation after the webinar. Please complete that as we use that to improve upon the offerings that we have. A few learning objectives for this webinar. By the end of this, participants will be able to describe some common elements of anxiety seen in American Indian and Alaska Native communities, describe the impact of anxiety in those communities, comprehend, recognize, as well as comprehend management. The National Indian Health Board was created by the tribes, and we advocate on behalf of all federally recognized American Indian and Alaska Native tribes. There are currently 574 federally recognized tribes that the NIHB works on behalf of. The National Indian Health Board is divided into 3 departments. There's Congressional Relations, the Policy Center, as well as the Public Health Policy and Programs Department, which is a department that Dr. Segay and I currently work in. Some of the things that we offer in that department are for technical assistance, trainings, as well as a variety of other programming and materials for Alaska Native and American Indian.
Excuse me.
Yes.
Excuse me. You are very muffled and we can hardly hear what you're saying. It started a few slides ago. Could you see if you can direct your speech towards your microphone? Maybe that might help.
Yes, I will work on that, and also turn up the volume as well. Thank you for letting me know. Okay, Dr. Segay, I will turn it over to you.
Thank you, Courtney, for that review. And I just want to apologize ahead of time. I know that many of us are basically using virtual conferences, Zoom, and what have you. So I apologize on our behalf if that happens. And so thank you for joining us. Again, I'm Dr. Segay. I'm Navajo from Navajo Nation, so I forgot to make mention of that. So here, the slides, basically mental and behavioral health statistics that we were able to research is that 70% of all AN, they suffer from some sort of mental or behavioral health disorder. And so breaking it down further, we broke it into psychological distress, which is 1.5 times more higher than the general population. So there was various reasons there, and it was interesting to see generational trauma, intergenerational trauma, historical trauma, all play a role in that. And so most significant that we've seen as far as mental health concerns included substance use disorder, suicide, anxiety, and PTSD. So I just want to make mention of that to show a baseline of how prevalent it is. So what is anxiety? So a lot of us, we hear that word anxiety, whether it's in everyday daily conversations, or maybe we hear it on the TV, or maybe we read it, you know, and some of us are quite not sure what does anxiety mean. Some of us might have a general idea, you know, oh, okay, maybe anxiety is a panic attack, maybe it's a separation anxiety, you know, so we kind of go through that. And so here is some basic information we want to provide. And so anxiety, ordinary anxiety, I want to use that term, is known as an emotional disorder. So basically it stems from the body's natural response to a stress, you know, and basically it's just about the future, you know, it's uncontrolled, you know, what's going to happen. And so here we use an example as a job interview, you know, so you're kind of feeling antsy, you're getting ready, you're kind of excited, you know, so we have a lot of mixed emotions going on there. And then you go for your job interview, and then you kind of, you know, anticipate like, oh man, I wonder what's going to happen. Am I going to get accepted? How did I do? And so that's an example of ordinary anxiety. And then a first date. So when you go on a first date, you have that anxiety too. It's like, oh man, am I going to like this person? Is this person going to like me? So you have a lot of questions. And so that's pretty much what I want to use as a baseline for ordinary anxiety. And so the DSM, the Diagnostic Statistical Manual 5, it was revised, has their own definition of anxiety. I also wanted to use that as a baseline. And so here are the signs of anxiety according to the DSM. So there is a clinical criteria. And so basically it will give out a list of what they refer to as symptoms. And then there's a timeline tied to that. So they would say, oh, you got to meet 3 out of the 6 for this duration in order to be clinically diagnosed. So I just want to make mention of that. And so what they have listed there for general anxiety disorder, also known as GAD, is excessive anxiety, worrying, apprehensive, expectation, just like I used the example of the job interview in the first day, occurring more days than not for at least 6 months. So here the timeline is 6 months, about a number of events or activities. So again, you're looking at what do you do every day, what's happening. And so at the same time, you find it difficult to control your worry. You know, some of us are able to, you know, control it and kind of slow it down, and some of us are unable to. So the next slide is here again, the anxiety and worry are associated with 3. So like I had alluded to earlier, so here you need to meet 3 of the criteria in order to get this diagnosis. And so again, there's a note there, just FYI, only one item is required if you're doing a diagnosis in children, or if a diagnosis is going to be done in a child. So here, restlessness or feeling keyed up or on the edge. You're easily fatigued. You know, you have a hard time concentrating, or your mind is going blank. You know, things like that. You get irritable. You're agitated. You have muscle tension, sleep disturbances. So some of us have a hard time falling asleep. When we fall asleep, you know, we have a hard time staying asleep. We get up about 1 a.m., we get up at 3. Sometimes when we know we have an important day, you know, we don't want to be late, so we tend to get up more frequently. And then we have that unsatisfied sleep. You know, we feel tired, we feel kind of groggy, you know. So those are some examples. Again, anxiety, worry, or physical symptoms cause clinically significant distress or impairment in social, occupation, or other important areas of functioning. So what this means is that, you know, ordinary anxiety, you're able to taper off, you're able to manage it. But with, you know, the anxiety, what they're looking at clinically is basically, say you go to work, you do something important, something that's a part of your daily routine, or maybe you work out, or maybe, you know, you have some sort of set organization, and all of a sudden, you know, you're unable to function in these areas. You're unable to carry out your routine. So that's kind of the key there, that's different. So, and this disturbance, it won't have any influence from any kind of substance like alcohol, meth, you know, whatever, or medication. So there's no alcohol or drug-induced psychological effect, or any kind of medical condition like there's an example. Disturbance is not better explained by another mental disorder. And so that's a baseline there. So again, ordinary anxiety versus, you know, clinical anxiety. So I just wanted to draw a baseline there to show here in this scenario. So here's anxiety due to COVID. So right now in these times, you know, we have a lot of anxiety presenting in American Indians and Alaska Natives at this time. You know, a lot of changes have happened. You know, our daily routine has changed up a lot from what was normal for us in the beginning. So now we're adapting and making all these changes. And so there's a lot of elements, there's a lot of moving parts. You know, we're talking about, you know, employment security. We're looking at, you know, food security. We're looking at housing security. And so all those become questionable. And so you start to develop stress. You start to worry and think, you know, what am I going to do? How am I going to do this? And even more, how long is this going to happen? How long do I have to keep doing this? And so it develops all different for everyone. And so that's pretty much, you know, what we're recognizing that's happening to our Indian country. So here is a scenario on how COVID-19 plays out. So we have, it begins as an ordinary day, and then you start, you know, it starts to affect your daily life. So here I'll use Ricky Bobby. So Ricky Bobby wakes up, you know, he kind of lays there, and then he starts to go into self-thought process. And so in his self-thought process, you know, today I feel good. He's laying there. I need to do this. So he's starting his mental checklist of what needs to happen for the day. So here, I need to wash laundry, I got to get groceries, I got to get gas, I got to haul some water for the cattle. So very general, so it starts out ordinary. So now Ricky Bobby gets out of bed, he starts preparing breakfast, starts taking a shower, and so his self-thoughts continue. So now he's thinking, oh man, I have to stand in line at the laundromat to wash. The laundromat only allows 5 people inside. I need to let my children stay with my mom since children are not allowed inside. I have 8 bags of clothes to wash. I need to pack my mask, my hand sanitizer, my clothes. I have to get water from the water hole about 100 miles away for the cows. That means I need to stop for gas. I also need to get lunch. I have to be in line again. Then I got to get groceries. Then I have to get in the line for food at self-checkout. I got to load the food after I get the water. And dang, that's a lot to do. But I can only come into town once every 2 weeks. I hate all this. It sucks. I wish it could be normal. And so he's already developing, you know, his thought process. So as you continue through the day, so now Ricky Bobby is actually doing these chores. His mental list, he's already doing that. So he's standing there, rats, the lines are too long. How long do I have to stand here? I'm too scared to touch anything. Shoot, I should have brought more sanitizer. I'm feeling a bit hot. Do I have the disease? What am I going to do if I have it? Who I'll take care of my children and do my chores? How long is this going to occur? Dang it, I hate this, I hate this. And then when chores get done, Ricky Bobby starts to think again. How much money do I have to last me until I get my next check? Did I have to wash all these clothes? Did I have to get all these groceries? Was it necessary? I need to shower. I might have contracted disease. I hope I don't have the disease. And then finally, he goes to bed. So as he's laying there, he's thinking to himself, I can't wait to fall asleep so I don't have to think about this. I hope I fall asleep right away. I wonder what's going to happen tomorrow. Wonder how my siblings and my relatives are doing. Why is this happening to us? How long does it have to be this way? I don't even know what to do about it anymore. So that's a general thought process of a person from the beginning of the day to the end of the day. And so, you know, through that thought process, there's different emotions that are being exhibited. So which brings us to our next slide, a discussion here. And like Courtney had indicated, go ahead and put your answers there in the chat box. So based on what was presented in this small mini scenario, you know, was Ricky Bobby exhibiting anxiety? If so, in what ways? And so I'll go ahead and turn it over to Courtney. Courtney, can you hear me?
Oh, yes, sorry, I had you on mute. Let me see what is in the chat box and we'll answer your question. Okay, you can proceed. There's no question.
Okay. All right, thank you for that. And so here, the next slide, what I gathered from the scenario is these are the signs that Ricky Bobby exhibited. So he was feeling restless, was kind of keyed up, you know, just by hearing his thoughts in regards to, you know, dang it, and, you know, language like that. How long do I have to wait? Things like that. Difficulty concentrating or mind going blank. So when you thought of the thought process, it wasn't organized, you know, it was just kind of scattered and random here and there, you know. He was irritated, standing in line, and irritated with the whole COVID, you know, how long it's going to go on, you know, what can I do, things like that. And then even the sleep disturbance, telling himself, well, I hope I can fall asleep right away, I hope I can stay asleep, you know. And so obviously, those were the signs that were exhibited. So this is what a lot of our American Indian, Alaska Native individuals are going through, you know, and it's all based on their local area, you know, their resources, the location. what's currently implemented as far as restrictions with COVID. So you're looking at all those factors, and so those factors, you know, I guess basically design or organize, not in a positive way, but it kind of leads up to, you know, where you're at with development of stress and anxiety, and so that's what pretty much happens. So I just want to make mention of that. Then at the same time, there are a lot of other signs, you know, like physical signs or symptoms that pretty much are out there, and these are just some that were very general and that we saw most commonly, so that's the one we shared here. And so some physical signs I just want to make mention of is like you start to notice your heart rate increases, there's like rapid breathing, you know, so those are kind of some of the physical attributes, anxiety attack, you know, so I just feeling of faint and dizziness, dry mouth, you get chills, hot flashes, fear, and so those are some of the physical signs of anxiety. So I just want to make mention of that. And so the next slide is, now that we've seen the symptoms of Ricky Bobby and what he displayed in the scenario there, a lot of us are going to think to ourselves right away, so it's just a normal, natural response when you feel your body or you notice, you know, some stress going on, you start to ask yourself, you know, what does this mean? What's going on? Oh man, I feel a slight ache on the side of my you know, my kidney or my side. What does it mean? I feel I got a headache. Oh man, what does it mean? So we kind of have that natural response. And so here, Ricky Bobby, you know, basically is wondering at this point, all right, this is what's going on with me, now what? So question someone might ask, could I have anxiety? Is this normal? How long will I feel this way? How do I cope with this? What do I do? Where do I get help? What is the treatment for anxiety? So these are just some questions, you know, I'm sure there's millions of other questions, but these are just questions we thought, you know, okay, this is what someone might ask. So now, moving into coping with anxiety, now that, you know, we know Ricky Bobby has anxiety, now, you know, what does he do? How does he cope with it? So here are some possible coping skills, and these skills are pretty much most common that we've seen out there. These are the practices that are happening, so we thought this was most relevant. And so again, taking breaks from any kind of COVID-19 news, discussion, jokes, topics, what have you. So it's all out there, especially on social media. We're hearing about COVID. We turn on the radio, we hear about COVID. You know, we turn on the TV, we hear about COVID. You know, the news has COVID. You have these television shows, you know, as far as talk shows, they have COVID, you know, so everything, it's COVID, it's COVID, it's COVID. So we hear that term frequently, maybe over 1,000 times a day. And so when you constantly hear something or you're constantly exposed, you know, to it, you know, it starts to wear on you. And so here we're saying, all right, take a break. It's all right to turn your TV off. It's all right to turn the radio off. It's all right to tell the person, you know, I don't want to talk about COVID right now. Is that all right? You know, so things like that. Taking care of your body. So here, just doing deep breaths, even sitting in your chair right now, or maybe some of you are standing, or maybe some of you are even lying down, you know, just taking deep breaths while you're sitting there. And also stretching, you know, doing some mild stretches, static stretches, holding for 30 seconds, you know, eating a healthy, well-balanced meal. I know that's really hard for a lot of us. A lot of us are kind of rush, you know, we're always trying to hurry up. But again, you know, what is a well-balanced meal? You probably can Google that and see, you know, what that means. But that's very helpful. Exercising daily on a regular basis, whether it's walking or being outside, you know, doing some physical chores, getting plenty of rest at night, including naps. And so, you know, if you feel like you need to take a nap, it's okay to take a nap. Avoiding alcohol, drug use, substance use, you know, we don't want to use that as a stepping stone, to help anxiety to be even more severe. Make time to relax with activities you enjoy. Connect and stay in touch with your circle of friends or family. Talk to those you trust. And so a lot of us have the phone lines. A lot of us, we might have like FaceTime or Zoom, where we can keep in touch. Practicing your cultural and spiritual practices. That's very important. Seeking behavioral or mental health professional, assistance from those individuals. So these are possible coping skills. There's millions of them, but this is some that we thought out was most common again. So again, during these trying times people are currently living in, it is uncomfortable. So again, people need to consider being more gentle with themselves through reassurance, prayers, forgive yourself for making mistakes while making adjustments, for the new norm. And so again, it's all of us. It's just not one population. It's just not one age group. It's not just one gender group. It's everybody. And so that's where, we have to learn and adapt and, use our resiliency, to bend back, to be flexible, whatever terms you want to use. So we just want to make mention of that, to each of you. And here is another possible coping skill. The slide here, I was really curious about, ways you're coping with anxiety, if you're dealing with it personally, or maybe in your community, you recognize some community members are dealing with anxiety, what are ways you're doing in your community, to help your members to cope with anxiety? Is there like messaging going on? Is there like special hours for mental and behavioral health services? Is there a calling line? I'm curious about that. So if you could share that there in the chat box, that would be very, very helpful. I appreciate that. And so moving on to the next slide, here are some possible activities. And these activities are free. You can do it anywhere. You don't have to have therapy, it's none of that. None of that is attached to this. So these are just some activities. I spoke to a clinician, and he was the one that says, "Oh, these are what we do. We let our people know this is free. They can do it anywhere from home. It doesn't require medication management, nothing." So again, exercise. So exercise is always there. More specifically, he talked about using the Bosu. Yoga, he picked that up, and then he said walking. So those are the top three. Doing an activity, so like craft work. I know we have a lot of artisans in American Indian, Alaska Native tribes. So beadwork, feather work, and then aside from that, like knitting, things like that. So those are some examples of doing activities. Spending time with your pets or your animals. I know a lot of people have cats and dogs. Some other people have livestock like cows and horses and pigs and sheep, so spending time with your pets or animals. Then another one is meditation. There's all kinds of meditation. There's all different sorts of styles. There's a variety. And so, what meditation will work for me. And so that's important. Listen and play music. And so that's where we basically, you can create a playlist. You can listen to, American Indian music, Alaska Native music, whatever you feel that might be able to help you to relax. Watching a comical movie, interesting. He said that if you watch like a romantic movie, it could get somebody who has anxiety can get depressed. So it was interesting, that connection. So he was really specific. He said, even if it's a dramatic movie, even if it was a dramatic movie, it would make them sad in a sense. So he said, make sure it's a comical movie. So I just want to point that out, comical movie. Breathing exercises, again, self-prayer. And what I mean by self-prayer is, as American Indian people, as Alaska Natives, we pray for ourselves. We get up in the morning, we pray, to the sunrise, in the afternoon, in the evening, we have our ways like that. And so sometimes just praying in the moment as we're driving, or maybe, as we walk in the house, that's very important. self-smudging too. You can smudge yourself, just burn some cedar, whatever you use, sage, using that self-tobacco offering too. And so the reason why I use self is a lot of times, as natives, when we say, oh, I'm going to go get a prayer or I'm going to go get smudging, it's always associated with an elder or a medicine person, and that's where that's different. So this one, that's why we pretty much said self, doing it for yourself. So here are just some facts about anxiety that I wanted to share. So a person has to meet a certain number of clinical symptoms in a certain time frame to be diagnosed with anxiety per the DSM-5. And so I alluded to that earlier. And so there was some symptoms that were written down, and that's for practicing clinicians. And I just wanted to highlight how they do it there, out of curiosity. And so again, if treatment is not sought, it can get worse. And so again, right away recognizing, what can I do, what's going to happen. So the most beneficial treatment for anxiety is CBT and medication management. And so a lot of clinicians, they say that this has been most effective when they're seeking treatment. So cognitive behavioral therapy. Women are most likely to develop anxiety compared to men. Anxiety will vary from person to person. So just because one person doesn't have these physical symptoms, doesn't mean that they don't have anxiety. Pre-existing conditions need to be considered with anxiety for proper treatment. So if somebody says is basically using substances and, they have some other issues going on, maybe with their health, comorbidity, co-occurring, and that's where, it's important to get a proper assessment, for proper treatment. So I just want to make note of that. Again, please get professional help if you are concerned about the possibility of having anxiety. And so we just want to send that message to those out there, make it known, continue to educate, let our people know through messaging, so that way they don't feel like they're alone, or maybe they don't feel like, what is going on with me? This is not normal. They don't have any kind of feelings like that. So group discussion here. And so go ahead and use the chat box again. Why is it important to know about anxiety? What value does knowing this information have beyond being educated? So there are comments and questions. Again, just looking at why it's important is that, again, like I said, individuals, especially in Indian country, a lot of our people are healthy literate. They were fortunate enough to have a formal education to be able to understand the terms, and the processes, when health issues arise, and so they don't know it's okay to ask about these things. They don't know, they just, that's just how we are as natives. We see somebody come in with a white coat, we have that white coat syndrome. We blink out, we don't want to ask questions because they're the doctor, they're educated. So we really don't want to say anything. And so, but if we put it out, in general education out there to our people, whether it's messaging through the radio, whether it's, creating materials to say this is what anxiety is, just that redundancy, that repetition of information, that's where they will begin to understand. And then they will recognize, oh, wow, this is what I'm going through. And so they do have some self-anxiety checklists. And so that's available out there to where, it'll give little symptoms and you can check it off there. It's like a little self-assessment tool. So even having that, and that way they know that, okay, something is wrong. How do I get it under control? How do I learn to manage it? How can I feel better about it? And so that's most important at the end of the day, is teaching them, that, okay, this is what you have, and this is how we manage it, and this is how we'll take care of it. And so just having that sort of lineup will help to bring some comfort. Then at the same time, they learn how to manage it through their daily routine, their lifestyle. And so I just want to go ahead and close with that there, and I'll turn it back over to Courtney.
Okay, thank you, Dr. Segay. Just a reminder to type all of your questions and comments in the chat box. While we wait for some questions, I wanted to share some of the coping strategies that were mentioned in the chat box. Quite a few people mentioned meditation and exercise. Watching
Hello,
movies
Courtney.
with kids. Yes.
Hey, this is Robert Foley, Chief Program Officer for the National Indian Health Board. Your audio is still going out, and so as I understand, you were just reviewing some of the coping strategies that were mentioned. And so for the sake of the audio, I'll go ahead and review that if that's okay, Courtney, with everybody.
Oh, thank you, Robert. That'd be great. If you would read
Okay.
the questions that are in the chat box as well, I would greatly appreciate it. My apologies.
Yeah. Yeah, no problem. There were a lot of great suggestions that came through on different coping strategies that people are engaging in. So we see people have purchased an exercise bike, even just getting outside and enjoying the sunlight, standing in the light. Gardening was a recurring activity. People have started journaling and practicing gratitude, which I think is connected also to mindfulness, which was mentioned a little bit later. Some guided meditations, hiking, using apps on the phone to help with deep breathing, attending Al-Anon activities and meetings, engaging in telehealth. So I feel like that's really great. People are seeking out some professional assistance in telehealth, especially expansion of telehealth that's taking place right now. Going for walks outside, exercising a little bit more, deep breathing, and deep breathing with your eyes closed. That was specifically mentioned. Hot showers or baths, running, and then spending just time in the yard. So spending time with pets and livestock, animals, painting, some more deep breathing, especially during the workday, listening to music, which I know Dr. Segay mentioned. You know, someone said, you know, in addition just to gardening, but just playing in the dirt and reconnecting with earth. And then somebody said texting a crisis line. They put a number here, and I don't know, I'm not familiar with this number, so I don't endorse it, but I will read the number, 741-741. And the person said that was very helpful. Yoga was mentioned, bike riding, weightlifting, mindfulness. Spending time with the kids. That's great, especially if we're not helping them with the schoolwork at this point. Because sometimes that schoolwork could be a little bit more stressful. People said connecting with friends, you know, talking with their friends, either whether it's on the phone or Zoom, but especially hearing laughter. This person found that helpful. Going for the long runs and actually tracking the miles, maybe creating a sense of accomplishment, and then listening to favorite songs, and then making time to play video games. That's a nice escape. Connecting with Mother Earth, and this person actually suggested being barefoot really helped him or her. Praying and giving things over to God and Creator, and repeating positive thoughts. And then one person mentioned that their local health department has started a meditation group for service providers and travel employees. That's really, really wonderful to help our service providers, our care providers engage in self-care. Somebody did provide a link to a Coping with COVID Anxiety workbook. And so please feel free to look at that. Someone else mentioned beading. We've heard meditation several more times. And laughing, connecting with family, playing games, watching a movie. And we know Dr. Segay suggested watching a comedy, outside chores. We hear a lot of things about just being outside. Somebody said listening to, R. Carlos Nakai, watching Smoke Signals. So R. Carlos Nakai, of course, is a flute artist. Exercise, watch movies with the kids. And then when there were a couple of people who actually mentioned engaging in some community work seemed to help them cope with some anxiety. So doing some food distribution. And that also is a community activity that the community is doing to ease other families' anxiety, especially about food security. So we have other people who are delivering some medicines and beading kits to some of the clients at the clinic, and then connecting with people, maybe even some of those clients weekly via Zoom. But that person did mention that people tend to prefer text or phone calls. Gathering traditional food and sharing that. And then so just having a prayerful mindset was good. And then there were some different resources shared around some breathing exercises. And then I'm going to go and read this question right now. Or it's more of a comment, but I think it's really good for us to keep in mind that, you know, we are 3, maybe even 4 months for some of us working on this COVID response. And so what stressed us out, what caused us anxiety, both as individuals and as communities 3 to 4 months ago might be different than what's causing us anxiety now. So in that same vein, we might need to entertain different coping strategies for different stressors. And I think that that's a really good suggestion. So thank you, Terry Horton. Somebody has mentioned sweats, especially since people are craving ceremony. We hear several people say that, craving ceremony, craving prayer, and they're connected it to the traditional ways. So somebody has said that they've used sweats a few times a month. And then I will read one of the questions that was asked is, why is it important to know these? Why is it important to understand the signs of anxiety? And so I want to read some of those responses to make sure we all know. If we know what it is, then we can figure out how to work on it. It helps to normalize what we're experiencing and understand that maybe we do need to learn some self-soothing techniques in order to feel validated. And if you know the difference between normal and abnormal anxiety, you can help family members and friends and serve as a resource for those other individuals, maybe not yourself, but actually reach out and help those who you can begin to see might be experiencing anxiety. And so instead, we got to help understand anxiety to help get it out. Let's see. We can always, so that we can be supportive and help to validate those feelings. And then, you know, Alicia had a good comment, so that we can help ourselves, but also help other people to realize it's okay to get help for yourself, you know, and move away from those kind of labeling and stigmatizing comments like you're being dramatic or tomorrow will be better. You know, even if we maybe in our heart of hearts know some of those things, if we're experiencing anxiety, we may not be able to really accept or internalize that kind of messaging. So recognizing and bringing to light will help normalize mental health treatment and disorders. And it's good for people to understand how to deal with the uncertainty, especially right now. And we want to keep them from venturing down into a rabbit hole. And so I'm now coming closer to the bottom, but helping people experience, you know, maybe experiencing loneliness from social distancing and not understand it. But while I'm continuing to look at these, there was a question, and so I will pose this to you, Dr. Segay. How can we help teens and young people cope with anxiety? Dr. Segay,
Thank you, Robert.
Oh, there you are. Oh, yes,
yeah,
of course.
I'm here. Thank you. Excuse me, my voice is raspy. So again, when you look at the physiological makeup and development of teens, very different from adults. And so again, looking at that makeup, it's going to be different. So there, it's going to require different coping mechanisms, different kind of treatment, you know. So as we looked at earlier for the DSM-5, there was 6 symptoms or signs that needed to be met for an adult. Actually, I'm sorry, I take that back. There was 6 symptoms, and so as an adult, you have to meet 3 of that criteria in order to have anxiety. But again, there, it only required 1 as a child. And so 1 as a child could be irritability over a certain amount of time. So that's how they distinguish the difference. And so as far as coping, a lot of times, because teenagers are very active, and so they look at more of the active physical exercises like sports. And then we're looking at pre-existing conditions. So some of them could have ADHD. So we're looking at all of that again. What do we do? And so it's helping them to develop coping skills such as breathing, again, going back to the list that was there. And so that's kind of what they use as the non-clinical way of coping, with anxiety. So I just want to point that out. And if you want more information on that, feel free to reach out to me. I can provide more information. Thank you, Robert.
Absolutely. And, I was just on a webinar earlier regarding children and youth. And one of the things that they stressed is that, a dysregulated adult cannot regulate a dysregulated youth. And so that really circles back around to some of the things we've been hearing about self-care and adopting our own coping mechanisms. And as Dr. Segay said, that helps us model it, for the youth, and also share with them that it's okay to feel some of this anxiety, and that, as a parent or as an adult, I'm feeling it, and it help a youth to normalize what they're going through as well. And so here's another question. Is telehealth available for behavioral health in rural areas and reservations? I just want to say absolutely it is. And actually there's been regulations going on during the pandemic to expand what is acceptable to bill under telehealth and telebehavioral health especially. And so now the extent and the capacity to enter into telehealth and behavioral health relationships locally at your local clinic or hospital, whether it be 638 or tribal or IHS, that I cannot speak to. So you'll definitely have to reach out to your local health facility to determine what telehealth is available. But do know that now more than ever, telehealth and telebehavioral health is available. And then, we have some wonderful additional coping strategies that have been listed, like being present in the moment, counting blessings, and learning to turn negative thoughts into positive ones, so engaging in some positive reframing. And then here's a question. Have tribes and reservation communities enlisted volunteers with training to do crisis intervention 24/7 on a helpline? Now, Dr. Segay, I'll, if you want to entertain this, feel free to think about it for a second, but I will say that to the best of my knowledge, on some of the mainstream suicide crisis lines, I don't know that there is a 24/7 staffed native line, or in some of these crisis intervention lines, but I don't know, Dr. Segay, if you have more information on that.
Okay, Robert, thank you. Robert is correct. On a national level, they do have the suicide crisis line with various federal entities. But on a tribal level, local level, there are some reservations who do have a crisis response team as opposed to crisis response line. And so a lot of these teams do manage 24/7. So the best way is to call your local mental and or behavioral health facility, whether it's a tribal operated clinic or IHS, or if it's a 638 Title I or Title V facility. And another place to find out is through your local dispatch with your law enforcement. So always asking the dispatcher. And so a lot of times, some of them are barely starting out. And so to get the message out there as far as contact information is not very much shared. But there are some, for example, here on the Navajo Reservation, we do have an active crisis response team. They are available 24/7. They work directly with law enforcement officers and the dispatcher. They also work with the fire department and the EMS department. So they're all linked together. So it's just a matter of finding out, where the core is. So it is available. And I do know that some tribes, they have asked to help to start up some sort of crisis response team. So that's ongoing. As far as the crisis response line, a lot of tribes, it's basically hard for them because of the geographical location, and then to staff, and as far as crisis line. So some reservations do have it, to my knowledge, but I'm not sure to what extent or which reservations. Thank you.
All right. Thank you, Dr. Segay. I want to say that there was a question in the chat box about using some of the more popular web-based platforms such as Zoom or Skype for telehealth or telebehavioral health, and there have been some responses to that. There have been some other platforms such as DoxyMe and Theranest and Simple Practice recommended. And we do know that when Zoom launched and became so popular that they were not HIPAA compliant, they have become. HIPAA compliant, but I'm not sure exactly what you need to do to engage in a HIPAA compliant session on Zoom. So that would definitely require some exploration with Zoom. It might require a special account or specific add-ons to a Zoom account existing. There were several resources and words of encouragement provided for our parents on the line who are experiencing crisis teaching at home. And so there were some resources, and hopefully as we approach the end of May, hopefully that experience will at least be waylaid for a couple of months as we all see the end of the school year approach. And somebody did mention that they heard of a group who shared COVID-19 during a sweat. I will say just real quickly that NIHB created a one-pager on sweat lodges and engaging in sweat lodges during the COVID-19 times. And it is true that the heat within sweat lodge is not, it is not hot enough. It does not reach a high enough temperature to kill the COVID-19 virus. I'm sorry, the SARS-CoV-2 virus. So thank you, William, for bringing that out. And then just cycling down here through the bottom, somebody mentioned using Cisco WebEx for telework. And Terry also comes back around and reminds us that these are unprecedented times, that we don't know what some of the long-term impact of this hopefully short-term crisis will be. And so that's certainly true, especially for our behavioral health professionals on the line. And that's definitely something I know that the field will be exploring in the coming months, and I know they're starting to already. Dr. Segay, would you be willing to share your credentials with the group again? Somebody's asking your credentials and if you're a psychologist or psychiatrist.
Thank you for that. So my credentials is out of ASU. I am licensed through the Arizona Board of Behavioral Health Examiners. I was a practicing clinician. So I've worked in the ED. I've also worked long-term in clinics and also on a crisis response team. So my education basically is a doctorate in behavioral health. Basically studied a lot of medication management, psychotropic medications. I'm also looking at a lot of psychiatric issues. And so, but I'm not a psychiatrist or a psychologist. I am a doctor in behavioral health, but I was trained to do integrated behavioral health care with PCPs. I hope that helps. Thank you.
Absolutely. And then we have some more, people are sharing some of their own resources via the Navajo Nation has an open crisis line. That's Monday through Friday. The Fresno American Indian Health Project, so one of our urban Indian health centers, has telehealth operating. If you text Native to 741-741, apparently you'll be connected to a Native specific crisis line operator. Again, I'm not familiar with that, but thank you for sharing that resource. And Courtney and Glorinda, do we have contact information for Dr. Segay and the other presenters on this line that's being requested? I didn't know if that might have been a final slide. I believe it is the final slide. So perhaps we want to put that up and people can have contact information for our presenters.
Yes, it's the final slide, Robert. Our email address is over.
Perfect. And also it was entered into the chat box. So there we have gsegay@nihb.org and cwheeler@nihb.org. And somebody's asked, wasn't there a lift on the HIPAA restrictions on the federal level because of the crisis? Yes, I'll say many of the HIPAA rules. Oh, and actually somebody actually commented on this, and so it's pretty much what I was going to say. Many of the HIPAA rules were relaxed for telehealth just because of the connectivity issue and accessing various different platforms, even just the phone lines. And so the answer to that is yes, although I will say that I think people seeking help tend to feel better to know that their information is being protected. So that's just something to think about. And then we have the Navajo, somebody put the mental health helpline at Navajo, the phone number 928-810-7357. And then somebody, William put it here, that good faith use of consumer video conference for telehealth would not be prosecuted for HIPAA noncompliance. So as an example of some of the relaxation of some of those regulations on telehealth. So if you're using some manner of video conference line, you know, that like FaceTime even, you know, or Skype that might not be HIPAA compliant or specifically HIPAA compliant, protected, secured, scrambled, or any of the above, that apparently you will not be sought out for prosecution. So thank you, William, for sharing that. And Courtney and Dr. Segay, those are all of the questions and comments in the chat box. I know that was a little bit long, but I just wanted to make sure all of those, especially the coping mechanisms, were shared out loud.
All right, thank you, Robert.
Thank you, Rob.
Oh, sorry, go ahead.
Go ahead, Courtney.
We just had a few wrap-up slides to go over. I'm not sure if I'm still going in and out.
It is, Courtney, and so it is going in and out, yes.
I can cover, Courtney.
Okay, let me get back to that slide. My apologies.
Okay. Thank you. So the next slide is take-home messages from this webinar. And so again, we're looking at the public health education, assisting and helping to understand what basic anxiety is. Also helping to advocate for those who suffer from anxiety, just like earlier, you know, for yourself or for others, how to recognize anxiety symptoms. So that's pretty much what we are hoping that you all would take home from this webinar. Next slide is closing. Here are resources, and so again, there are a lot of resources that were shared there in the chat box, so thank you for that. And so again, these are just some resources that we thought, you know, was most relevant and most commonly used, but again, there are hundreds of resources out there, so feel free to not limit yourself. And then here are the references that we used as we presented this webinar to you today. Any kind of final questions, comments, go ahead and put in the chat box. And again, at the end of this webinar, Courtney will send you a link. This is where you complete and submit your evaluation. It's not hard. All you got to do is submit, press the submit button. I know some people, evaluations can be tedious, but we appreciate if you could submit so we can improve, you know, our services. And then that will be it. So yeah, thank you for joining us on this webinar today. Back to you, Courtney.
Hi, just a reminder, we will be sending out the slides and the recording. Give us a few days just to make sure we can have it up on our website. There are a lot of services and resources that were shared in the chat box. We will compile a list to share that out as well. If you have any questions after this webinar, you can email Dr. Segay or I, and we will get back to you as soon as we can. Again, thank you everyone for joining the webinar, and we will send out notification of when you are able to register for the next one in the series. Thank you and have a good day.
Thank you.